Welcome to this informative lecture on smoking cessation. Cigarette smoking is the most important preventable cause of premature deaths. Cigarette smokers have a higher risk of developing several chronic disorders. These include fatty buildup in arteries, atherosclerosis, several types of cancers, and chronic obstructive pulmonary disease, COPD. Atherosclerosis is a chief contributor to the high number of deaths from smoking and is caused by the buildup of fatty substances, plaque, in the arteries. Many studies have shown that cigarette smoking is a major cause of coronary heart disease, which leads to incidences of heart attack. The ability of an individual to quit smoking will depend a lot on the determination of the individual and on the products that help the individual beat the addiction. Smoking cessation has received a Class 1 clinical recommendation from the American Heart Association and remains a top health priority. Patient counseling tips for pharmacists. Request your patients to stop smoking completely when they begin using the patch. If your patient smokes more than 10 cigarettes per day, suggest that they adopt the following 10-week schedule. Step 1. Use one 21 mg patch a day for the first 1 to 6 weeks. Step 2. Use one 14 mg patch a day between weeks 7 and 8. And Step 3. Use one 7 mg patch a day for weeks 9 and 10. If your patient smokes 10 or less cigarettes per day, advise them not to use Step 1, 21 mg, but instead to start with Step 2, 14 mg for 6 weeks, then Step 3, 7 mg for 2 weeks, and then stop.